Good morning. Welcome. I would like to introduce Mrs. Jane Doe. She has been very kind to allow me to demonstrate how I do my Sculptra injections. And I went over the initial consultation with Mrs. Doe. She came in because she was concerned about a lot of wrinkles on the face, and if you could kindly smile. And when she smiles, you can see the wrinkles here, and she was not happy with that. And this is after Botox, actually. She's had Botox, but she still gets those wrinkles everywhere. Do those bunny lines for me, Sylvie. There you go. So as you can see, and she's had Juvederm as well, and Botox all over here, but still she gets wrinkles. And what I pointed out to Mrs. Doe is that with time, what happens to all of the faces is that everything starts shrinking because of lack of collagen. As we age, we lose intracellular matrix, which is the volume in our tissue, and also the amount or thickness of collagen layer. As it shrinks, the effect is very similar to turning from like a grape to a prune. And as we deflate, whatever is holding up the whole face up there, like this is what she was in her 20s and 30s. It starts coming down because it's deflating, and gravity can now bring it down, and there you go. There it goes down this way. The result of that then is exaggeration of the nasolabial groove, which by the way is a very natural groove. It is aesthetically pleasing groove because you will find young beautiful girls with these grooves, but they look great because it's all about the harmony and balance of the face and symmetry. It's not about those grooves that we have been focusing on for a very, very long time. If we can sculpt the face to look like what it did 20 years ago for Mrs. Doe, she would be very happy. She could care less about the grooves then, because what she cares is about the composite, the whole face. And that's what I like to recreate. Typically when I see the patients, I take a good look, I explain all this, and then I tell them my reasons for choosing Sculptra. I was a big injector of other fillers, which I still like, but I've been using a lot more Sculptra for a couple of reasons. One, the duration, 2 to 3 years. 2, it is your own collagen, not Sculptra, that you are hanging on to. 3, to me it's like laying bricks of collagen with each session of Sculptra. You create a foundation of collagen. Every time you get an injection, it builds up. Now, typically we recommend that you come every month to get an injection or a session of Sculptra till you get the desired result, anywhere from 3 to 5 sessions. However, not all the patients can afford to come every month, and they feel like, what if I can't? And I tell them that's okay. If you can't, that's fine, because you're not going to lose that collagen you got. Whenever you feel like, okay, I got the extra money, you want to come, and you do another session, you're adding on to that layer of collagen. So it is a win-win situation. Number 4, it is natural. It is going to look natural. It's not going to look artificial, because you're recreating what the patient used to look like by just adding some more collagen. I have had incidents where in the past I injected on the face, somebody said, I hate these lines here. And I said, oh yeah, let's fill them up. I filled it up here, and these grooves, they look like a little chipmunk here, and they got mad. I didn't understand it. I was like, what did I do wrong? I was missing the whole concept of the sagging of the face downwards. This sags downwards, this way, you get the groove. This whole part of the lower mandibular area and the cheek goes down this way, and you get what I call the marionette chin triangle. And this triangle is very prominent because number 1, this sagging effect coming down, and number 2, the bone of the chin, the mandible, will lose with age, so it kind of shrinks into your face. And this is the effect that you get, the marionette chin triangle depression. It's also called the pre-jowl sulcus. So Sculptra can address all those things by adding up in the areas that you are deficient instead of just filling each individual groove. It has been a difficult journey for myself to figure out this concept, and it came from, not from my own self. Honestly, I can't take the credit, from other instructors who have over the years figured it out, like, it's all about volume, the right amount in the right places, not about the individual grooves. One thing I did learn was I did a facelift way back on a patient, and 2 weeks after the facelift, she was very, very excited. 6 months after the facelift, she was happy but not that excited. And I asked her, like, why? After this facelift, when you were still swollen and, you were recovering, you were very happy and not as happy now. And she said, I like it, but after 2 weeks, I mean, I looked like I used to look in college. It was just so great. I went back to her photographs and I saw that it was basically the swelling effect that the edema from the surgery, not a lot, but just enough, had done that little puffing up and smoothened out the wrinkles, and she loved it. That was like a eureka moment, moment for me, like, wow, that's what it is. If we can get that effect, we are good. So now based on that, this is how I do it. I usually mark the patients, and if you can see, I've already marked, and not only that, I usually write down the amount of cc's that I will inject. My dilution is 10 cc's, and I prepare it with 6 cc's of bacteriostatic water, and I do it at least 2 days in advance. Sometimes I let them sit longer. Then on the day when I'm going to inject, I add 4 cc's of 2% plain lidocaine, and then shake it up, and it's ready to be injected. To prepare the patient to minimize bruising, I have the patient stop all NSAIDs or related products for 2 weeks, flaxseed, fish oil, a big culprit, and coenzyme Q10, omega-3s, or any supplements that are non-essential. Stop them for 2 weeks. I tell the patients to wash their face aggressively before coming. Put the amla cream as a numbing cream, a thick layer, and also take a little Xanax, like 0.25 milligram. And I tell them to be careful. If they feel too sleepy, then have somebody drive them. And that makes it a very easy experience, because they're not anxious, and their blood pressure stays low, and they're less likely to bruise. And with those precautions, it is really is, most of the patients find it really no downtime procedure where they can go right back to work or their activities. So we'll be working on Mrs. Doe today, and demonstrate exactly how to inject. I have marked the areas that I thought she was deficient in, and I'll quickly point those out again. She's not crying, she's just having a little irritation from the cream I use, Zcaine. Zcaine has a little alcohol in it, and when it evaporates, it can irritate the eyes, and that's what she's experiencing. So I'm going to place 3 cc's here, 1 in this area, and then I'm creating the jawline here by 1 cc, and same on the other side. I'm going to make her a little comfortable now so she can be relaxed. Are you relaxed, Jane? Mm-hmm. Very good. Jane, I'm going to be having you just hold pressure for me as we inject, because my assistant, I forgot to have her come in. Actually, I didn't even think we were doing the video today. I'd forgotten, but you can be my assistant as well. By the way, I love your bracelet. The peace bracelet is very nice. Very nice. I talk to the patient a lot. I try to distract them, talk about their family, friends, whatever they're wearing. And especially women, if you talk about jewelry, they get distracted very easily. And that is very essential, because then they will relax. So how was your Christmas? You had a good time? Mm-hmm. Was Santa nice to you or no?
Yes.
He was? Very good. Okay. And Jane, I got to point out something. When I'm injecting around this area, I have the numbing medication lidocaine in there. And what it does is it numbs up your lower eyelid. And it feels a little strange. It feels like, there's something in the eye, or it feels like I can't close my eyes. And it's just a strange feeling. It goes away within an hour, and don't let it bother you. The reason is, if I don't explain to you, you'll feel like maybe something is wrong. Nothing is wrong. Okay, great. So coming over here, I have my Sculptra ready to go. And although I have cleaned the tip before I do it again, I'm just very, very particular. And I don't just clean like this. I scrub it just in case there's any germ anywhere. You cannot be clean enough and crazy enough trying to make sure that everything is really, really good. So I clean it like it's going in my own face. And there we go. I use a 3 cc syringe with a 21 gauge needle. You can see the foam on the top, and that's all that methyl cellulose, which is useless. It has no value whatsoever, so we don't care about that. And I'm going to shake it a little bit more to make sure there's no particle anywhere. And then I will enter. I use this side. If you see, there's a little gap between the two, the red rubber stopper. So this way I can see my needle, and when I'm looking, and I can start pulling it down. and I can see that I'm not getting any particulate matter or anything, any foam. And if you get, it's not a big deal, you can always shake it out.